Looking to demystify Avonex? You've come to the right place. In this comprehensive video, we'll walk you through how this medication works, its various uses, and potential side effects. Whether you're new to Avonex or have been considering it for your medical needs, we aim to provide you with accurate and reliable information. Avonex is a widely prescribed medication for the treatment of multiple sclerosis, MS. Using a synthesized version of interferon beta-1a, it helps to reduce the frequency and severity of MS symptoms. By boosting the immune system and reducing inflammation, Avonex can slow the progression of the disease and improve overall quality of life. In addition to discussing the efficacy of Avonex, we'll explore the different administration methods available and delve into potential side effects. It's important to have a balanced understanding of any medication, and Avonex is no exception. So, if you're curious about Avonex and want to gain an in-depth understanding of its mechanisms, uses, and potential side effects, keep reading. We'll provide you with the knowledge you need to make informed decisions about your health. What is Avonex? Avonex is a medication approved by the U.S. Food and Drug Administration, FDA, for the treatment of relapsing forms of multiple sclerosis, MS. It is classified as an immunomodulator and is derived from a naturally occurring protein called interferon beta. Avonex is administered via intramuscular injection and is typically given once a week. The main active ingredient in Avonex is interferon beta-1a, which is a synthetic version of a protein naturally produced by the body. Interferon beta plays a crucial role in regulating the immune system and reducing inflammation. By introducing interferon beta-1a into the body, Avonex helps to modulate the immune response, reducing the frequency and severity of MS relapses. Avonex is known for its ability to slow down the progression of MS and reduce the number of relapses experienced by patients. It is not a cure for MS, but it can help manage the symptoms and improve overall quality of life for many individuals. How does Avonex work? Avonex works by modulating the immune system and reducing inflammation in the central nervous system. In MS, the immune system mistakenly attacks the protective covering of nerve fibers, known as the myelin sheath. This results in disruptions in the transmission of nerve signals, leading to various symptoms such as fatigue, muscle weakness, and coordination problems. The interferon beta-1a in Avonex helps to regulate the immune response by suppressing the activity of immune cells that target the myelin sheath. It also promotes the production of anti-inflammatory molecules, which further reduces the inflammation in the central nervous system. By modulating the immune response and reducing inflammation, Avonex helps to slow down the progression of MS and reduce the frequency and severity of relapses. It can also help improve overall function and quality of life for individuals with MS. Uses of Avonex. Avonex is primarily used for the treatment of relapsing forms of multiple sclerosis, MS. It is effective in reducing the frequency and severity of MS relapses, as well as slowing down the progression of the disease. Avonex has been shown to decrease the number of new brain lesions seen on MRI scans and delay the accumulation of disability in MS patients. In addition to its primary use in MS, Avonex may also be prescribed off-label for other autoimmune conditions such as rheumatoid arthritis or psoriasis. However, it is important to note that the FDA has not approved Avonex for these conditions, and its use in these cases should be discussed with a healthcare professional. Avonex is not recommended for the treatment of primary progressive MS, as it has not been shown to be effective in this form of the disease. It is most commonly prescribed for individuals with relapsing remitting MS, where there are periods of relapses followed by periods of remission. Potential side effects of Avonex. Like any medication, Avonex can cause side effects. The most common side effects include flu-like symptoms such as fever, chills, muscle aches, and fatigue. These symptoms usually occur within 24 hours of taking the medication and may last for a few days. They tend to decrease in severity as the body adjusts to the medication. Other potential side effects of Avonex include injection site reactions, such as redness, swelling, or pain at the injection site. These reactions are usually mild and transient, but if they persist or worsen, it is important to consult a healthcare professional. In rare cases, Avonex may cause more serious side effects, such as liver damage, depression, or suicidal thoughts. It is important to be aware of these potential risks and to seek medical attention if any unusual symptoms occur. Who should not use Avonex? Avonex is not suitable for everyone. It is important to inform your healthcare professional about any pre-existing medical conditions, as well as any medications or supplements you are currently taking, before starting Avonex. Avonex should not be used by individuals with a history of hypersensitivity to interferon beta or any of the other ingredients in the medication. It is also contraindicated in individuals with a history of liver disease or severe depression. Pregnant or breastfeeding individuals should consult their healthcare professional before starting Avonex, as its safety during pregnancy or lactation has not been established. Avonex administration and dosage. Avonex is administered via intramuscular injection, typically in the thigh or upper arm. The injection is usually given once a week, on the same day each week, to maintain consistent levels of the medication in the body. The dosage of Avonex may vary depending on the individual's weight and their response to the medication. It is important to follow the prescribed dosage and administration instructions provided by the healthcare professional. Avonex comes in a pre-filled syringe, which should be stored in the refrigerator. Before administration, the syringe should be allowed to reach room temperature for approximately 30 minutes to minimize injection site reactions. Tips for managing side effects of Avonex. If you experience flu-like symptoms after taking Avonex, there are several strategies that can help manage these side effects. Taking over-the-counter pain relievers such as acetaminophen or ibuprofen can help reduce fever and muscle aches. Staying well hydrated and getting plenty of rest can also aid in recovery. To minimize injection site reactions, it is important to follow proper injection technique. Clean the injection site with an alcohol swab before administering the medication, and apply gentle pressure to the site after injection to help minimize any bleeding or bruising. If side effects persist or become bothersome, it is important to consult your healthcare professional. They may be able to adjust the dosage or provide additional strategies to manage the side effects. Important considerations when using Avonex. When using Avonex, it is important to follow the prescribed dosage and administration instructions provided by your healthcare professional. Do not stop or adjust the dosage without consulting your healthcare professional, as this may affect the effectiveness of the medication. Regular monitoring and follow-up appointments with your healthcare professional are important when using Avonex. They may order blood tests or imaging scans to assess the response to the medication and monitor for any potential side effects. It is also important to maintain open communication with your healthcare professional and report any unusual symptoms or changes in your condition. They can provide guidance and support throughout your treatment journey. Alternatives to Avonex. While Avonex is an effective medication for the treatment of multiple sclerosis, there are other options available. Some alternative medications include other forms of interferon beta, such as betaseron or Rebif, as well as non-interferon options such as Tecfidera or Tysabri. The choice of medication will depend on various factors, including the individual's specific MS subtype, their response to previous treatments, and their preferences. It is important to discuss the available options with a healthcare professional to determine the most suitable treatment plan. Conclusion. Avonex is a widely prescribed medication for the treatment of multiple sclerosis. By modulating the immune response and reducing inflammation, it helps to slow down the progression of the disease and improve overall quality of life. While Avonex may cause side effects, they are usually manageable and tend to decrease in severity over time. If you are considering Avonex for your medical needs, it is important to have a thorough understanding of how it works, its uses, and potential side effects. By discussing these aspects with your healthcare professional, you can make informed decisions about your treatment plan. Remember, this video is intended for informational purposes only and should not replace professional medical advice. Always consult a healthcare professional for personalized guidance and recommendations based on your specific circumstances. Thanks for watching.